Hey everyone, and welcome to another healthcare news episode. Today we'll be covering everything from the month of June. We couldn't go the whole month of June without talking about the presidential debate and the healthcare claims that both presidents made, so that's what we're going to start with. We're also going to go in depth into a new HIV drug that has been showing promising results in young African women. We'll talk about a case of fraud with an ADHD telehealth startup, and we're going to debunk pharmacy benefit managers. After that, just like last month, I'll run through the rest of all relevant healthcare news from this month so that you can have a full picture of what's going on. I'll keep those sections very concise, so make sure to check the timestamps for any section that you might be interested in. With that, sit back and enjoy today's episode. You are now listening to the Gustavo Franco podcast, where we challenge the norms and uncover the truths of our healthcare system. I'm your host, Gustavo Franco. All right, everyone. So let's start with the presidential debate. And I want this section here to be kind of structured. I'm going to start with topics related to healthcare, such as abortion and drug pricing, and then I'm going to go into the claims that each of the presidents made, and we'll analyze those claims, right? So this week's debate between Biden and former President Trump covered many hot-button topics, with healthcare surprisingly taking center stage. Both candidates presented their takes on key issues, but how much of what they said is actually true? Let's break down their claims on various healthcare topics and see what actually holds up under scrutiny. First up, abortion. Trump claimed, quotes, "The Supreme Court just approved the abortion pill," end quotes. This is false, or he's saying it in a way that would indicate something else. The Supreme Court did not just approve the abortion pill. It dismissed a case that challenged the use of abortion pill due to a lack of evidence. Trump's statement completely misrepresents the court's decision. Now, let's look at Biden's response. He said that Trump has made false claims about Democrats supporting abortion up to birth. Well, that's true. There is no evidence to support the idea that Democrats advocate for killing babies after birth, which is illegal. Most Democratic leaders support abortion rights within Roe v. Wade's framework, which typically limits access post-viability unless the mother's life is at risk. So that is probably what former President Trump was trying to get at. The idea that if a mother's life is at risk, yes, late-stage abortion does happen sometimes. Now let's move on to drug pricing. Biden claimed, quotes, "We brought down the price of prescription drugs to $15 for an insulin shot," end quotes. Not really true here. Biden's Inflation Reduction Act capped insulin prices at $35 per month for Medicare beneficiaries, not $15 per shot. The misstatement about the specific price doesn't detract from the broader achievement of reducing insulin costs, but the way he said things kind of suggests that he brought down the price of insulin for everyone to $15, which is just simply not true. Here, Trump also claimed, quotes, "I'm the one that got the insulin down for the seniors," end quote. Once again, this is mostly false. Trump did introduce a pilot program that capped insulin costs for some Medicare plans, but it was limited in scope. Biden's policy now is broader, making the cost cap mandatory for all Medicare plans. Now let's touch on the Affordable Care Act, or the ACA. Biden claimed that Trump wants to get rid of the ACA. And, once again, the statement is half true, right? Trump has wavered on his stance. While he initially aimed to repeal and replace the ACA, he recently stated that he wants to, quotes, "make you better," end quotes, without providing specific details. His past efforts to dismantle the ACA contrast with his current more vague promises, such as the ones that he has on other issues as well. Now let's move on to the COVID-19 pandemic. Here, Trump claimed that Biden's vaccine mandates were ineffective and more people died under his watch. Well, the statement is a little misleading. While it's true that more COVID deaths happened during Biden's term, the higher death toll reflects the pandemic's trajectory and broader population exposure over time, rather than a direct consequence of the vaccine mandates. Biden's response here highlighted Trump's suggestion to consider injecting disinfectants during the COVID pandemic. And this one's interesting. It's exaggerated, but is based on truth. While Trump didn't explicitly tell Americans to drink bleach, he did suggest disinfectant injections that could be explored at the beginning of the COVID pandemic, a statement that has been widely criticized and ridiculed. Now let's talk a little bit more about Medicare. Here, Biden claimed that his administration saved Medicare billions by reducing drug costs. And this here is true. The Inflation Reduction Act's provisions, including direct negotiations for drug prices, allow us to save significant costs in Medicare. Trump here claimed that Biden is hurting Medicare by allowing migrants into the country. False. Well, immigrants, especially those without legal status, are generally not eligible for Medicare. Legal immigration could potentially bolster the workforce, even supporting Medicare's solvency rather than draining it. So, for some final thoughts, both Biden and Trump presented their healthcare accomplishments and criticisms. But we gotta be able to separate truth from exaggeration and falsehoods, because there was a ton of that in the debate this week. So, this is definitely something that I'm going to continue to watch for in the coming months before the election, and I'm sure there are going to be very interesting claims made until then. But now let's move on to the new HIV drug that showed promising results in young African women. The HIV drug lenacapavir, which only needs to be injected twice a year, provided total protection from the virus for young women. So let's dive deeper into the trials and the results. The Purpose 1 trial was conducted in Uganda and South Africa, testing lenacapavir against two other daily pills, Truvada and Descovy. The trial was a huge deal because it included over 5,300 young women aged 16 to 25, making one of the largest and most inclusive HIV prevention trials ever. And the results, absolutely stellar. None of the 2,134 women who received lenacapavir contracted HIV. In comparison, 16 of the women who took Truvada and 39 of the women on Descovy did get infected. The data was so convincing that the trial was even stopped early so all participants could be offered the injection. Sit back and just take that in for a second. The trial was deemed basically unethical to keep going because the new drug was just so successful. So it would have been unethical to keep the other patients in other drugs that were not lenacapavir. But what's the downside, right? Because, as you know, usually in healthcare, there's always a catch. Well, the current cost of lenacapavir in the U.S. is a whopping $42,250 per year per patient. Obviously, that price is not feasible for low-income countries. Gilead, the drug's maker, said that they're committed to making the drug available at affordable prices in high-incidence, low-income countries. They plan to work with generic drug manufacturers to eventually offer a cheaper version, but that could really end up taking many more years. The bigger picture here is that this isn't the first long-acting injectable PrEP or pre-exposure prophylaxis drug. We talked a ton about this drug in my episode of Sharon Lewin, so make sure to check that out. Now in next steps, Gilead is conducting another trial, Purpose 2, to test lenacapavir in men who have sex with men, transgender individuals, and people who use injection drugs. Results from that trial are expected later this year, and if all goes well, lenacapavir could soon become a vital tool in the fight against HIV across multiple high-risk groups. So while there's still a ton of hurdles, this is definitely a very significant accomplishment. Now let's move on to an interesting case of fraud this month. Rufia He, the founder and CEO of Dunn Global and the clinical president of the company, David Brody, were arrested for a massive scheme involving the distribution of Adderall and other stimulants through telemedicine. This case marks the first criminal drug prosecution by the Justice Department connected to telehealth for providing controlled substances. Reports for this case say that the company amassed over $100 million by prescribing more than 40 million Adderall pills and other stimulants without adhering to proper medical oversight. Apparently, they exploited loopholes in telemedicine regulations with the goal to maximize profits by attracting subscribers through deceptive marketing tactics and bypassing medical assessments. As Attorney General Merrick Garland put it, the, quotes, defendants exploited the COVID-19 pandemic to develop and carry out a $100 million scheme to defraud taxpayers and provide easy access to Adderall and other stimulants for no legitimate medical purpose, end quotes. The thing is, though, they've been around for a couple of years now, so we have to think about what to do with all of the patients that have been taking these drugs and now maybe more reliant on them. And think about the impact of this whole scheme and what it actually did to Adderall availability, because we've had serious problems with Adderall availability in the past years, preventing people that actually needed the drug from getting it. Now let's talk about pharmacy benefit managers. Specifically, let's debunk what they actually do. This month, there was a super cool article on the New York Times about pharmacy benefit managers, and I really encourage you to check it out. But let's talk about pharmacy benefit managers. They are the middlemen in the healthcare system that are supposed to help reduce drug costs for everyone. But surprise, surprise, it turns out they're often doing the exact opposite. They're making prescription drugs more expensive for millions of people, employers, and even the government. So let's break things down. Pharmacy benefit managers, or PBMs, manage prescription drug benefits for over 200 million Americans. The big three, CVS Health, Cigna, and United Health Group, are the major players here. Their job is to negotiate with drug companies, pharmacies, and decide which drugs patients can get and at what price. In theory, this should save everyone money, but in practice, it doesn't really do that. PBMs have a sneaky way of steering patients towards more expensive drugs. They often shun cheaper alternatives and charge multiple times the wholesale price of a drug, keeping most of the difference for themselves. For example, they've pushed patients towards pricier brand name drugs over cheaper generic forms. Why? Because higher prices mean bigger discounts or rebates from drug manufacturers, which the PBMs often pocket themselves. But what they do isn't just about pushing expensive drugs. They also rake in billions from hidden fees. They've set up subsidiaries that collect these fees from drug companies, which don't go back to reducing healthcare costs, but rather to boost PBM's profits. A prime example is how Caremark, a CVS subsidiary, overcharged Oklahoma's state health plan by more than $120,000 a year for a single patient's cancer drug. So even though PBMs were initially created to help us save money in the healthcare space, well, similar to all or most facets of healthcare, they found a way to be profitable and actually increase healthcare costs. So I highly recommend reading this piece. Now let's move on to the quick news for the month, the news bites, right? I'll be very concise here, so just pay attention because I might briefly mention something that you're interested in, but I'll include everything in the newsletter with links that you can go check out the actual articles. Let's start off with updates on abortion and maternal and child health. In Florida, A new law allows C-sections in outpatient birthing centers, but experts are worried here. They say that these centers lack the immediate resources of hospitals, posing risks for mothers and babies. The anti-abortion movement is showing cracks. The Southern Baptist Convention voted against IVF, revealing internal divisions. Plus, the Supreme Court upheld access to the abortion pill mifepristone. But the fight isn't over as anti-abortion groups plan their next steps. Abortion travel overall has surged. Over 171,000 people crossed state lines for abortions last year, doubling 2019 figures. Illinois saw the highest influx, highlighting the impact of state bans. Clinics are stepping up, but the travel and costs remain tough. Senate Republicans blocked a bill to protect IVF access this month, which was part of a broader Democratic strategy to spotlight reproductive freedom ahead of the elections. The bill aimed to guarantee fertility treatment rights and insurance coverage. Now let's talk about surgery and medical procedures. In Phoenix, EMTs are now using body-sized iced cocoons to treat heat victims. These are pretty cool ice-filled bags that help cool patients down really quickly, a technique borrowed from military and sports medicine. With record heat waves, this method is being rolled out to combat the rising heat-related illnesses. In transplant news, remember the pig kidney patients that we talked about? Well, this month, a pig kidney transplanted into the critically ill patient was removed after 47 days due to blood flow issues. The organ showed no signs of rejection, but still, it's another showcase that complications still exist here. This month, the Biden administration took a stand against gender-affirming surgeries for minors. This came after reports of internal discussions about lowering age minimums for such procedures. So, while being supportive of gender-affirming treatments, the administration draws the line at surgeries for those under 18. Now let's talk about mental health. There was quite a bit in mental health this month, actually, but it was all surrounding the same topic, and that was what U.S. Surgeon General Dr. Vivek Murthy said. He's pushing for a warning label on social media platforms, suggesting that they harm teen mental health. While many parents and teachers support this move, some scientists argue that the evidence does not fully support such a broad warning. They claim that what teens do on social media matters more than the time spent on social media. Despite the debate, Dr. Murthy insists on action to protect young users, citing increasing concerns over the mental health crisis among adolescents. On viruses and bacteria this month, well, Miami is ramping up its fight against mosquitoes due to a spike in dengue fever cases. With almost all cases linked to international travel, Miami-Dade Mosquito Control is using advanced tracking and spraying techniques to prevent an outbreak in Miami. In other news, the CDC recommends new COVID-19 vaccines for everyone 6 months and older this fall. As new variants emerge, the vaccines aim to provide updated protection, especially for high-risk groups like the elderly and very young children. Now let's talk a little bit about new research, studies, and milestones. There's been quite a lot this past month, and they're all pretty interesting. The American Cancer Society has launched a study called Voices of Black Women, a groundbreaking study targeting cancer in Black women. This 30-year study aims to enroll 100,000 Black women to understand the higher cancer incidence and mortality rates in this group. Researchers will examine various factors from personal care products to environmental exposures to uncover the causes behind these disparities. Breast cancer is honestly a super interesting topic, and the disparities within breast cancer are even more interesting. Be sure to check out my episode of Dr. Christopher King, where we talk a lot about these disparities. Now, a recent study highlights significant racial disparities in Medicaid re-enrollment. Black and Hispanic Americans were twice as likely as white people to lose Medicaid coverage due to bureaucratic hurdles. This issue emerged after a pandemic-era policy that ensured continuous coverage, which ended last year, leading to millions losing their health insurance. And well, turns out there are disparities here too. In Alzheimer's research, scientists discovered a genetic variant in a Colombian family that delays the onset of Alzheimer's disease by 5 years. This finding could pave the way for new treatments that mimic this protective effect, potentially delaying the disease's progression in others. On a more controversial note, Dr. Huao-Yung Wang, a researcher involved in Alzheimer's drug development, has been charged with fraud. Accused of falsifying data to secure $16 million in NIH grants, Dr. Wang's work supported research into a diagnostic test and the drug Simofilm, which is now in advanced clinical trials. This case has cast a shadow over the new drug's future and raised concerns about research integrity. Now let's talk general well-being news. New York State is taking a stand on children's mental health with a new bill that restricts the use of algorithms on minors' social media feeds. Set to take effect 6 months after the state attorney's general regulations are released, this legislation mandates parental permission for algorithm content for those under 18. Additionally, social media companies cannot send addictive feed notifications to minors between midnight and 6 a.m. without parental consent. This month, a recent research has been raising concerns about the popular sugar substitute xylitol. This additive, which is often found in, quotes, low sugar products, end quotes, has often been linked to double cardiovascular risks in a study of over 3,000 participants. While the study doesn't prove causation, it highlights the need for cautious consumption of sugar-like substitutes. Now let's talk about those prebiotic sodas that you see in the supermarket, like Poppy and Olipop, which claim to benefit gut health. Well, turns out experts say that you don't really need to drink these to nourish your gut microbiome. While these sodas contain prebiotic fibers that feed beneficial gut bacteria, many natural foods like garlic, onions, and whole grains offer the same benefits. So you don't really need to be drinking these prebiotic sodas if you're doing so just for the prebiotic health. Now let's talk drugs and alcohol. Baltimore, as we talked about last month, is grappling with a severe overdose crisis, with nearly 6,000 deaths since 2018 due to fentanyl-laced drugs. In response, the City Council will hold hearings to scrutinize the city's strategies and explore budget adjustments to enhance overdose protection. This move follows a $45 million settlement with Allergen, aimed at funding addiction support programs. In a troubling development this month, Diamond Shrooms edibles have been recalled after 39 people across 20 states felt ill, with severe symptoms linked to toxic levels of muscimol. The Justice Department and FDA have launched a multi-agency effort to combat the surge of illegal e-cigarettes, particularly flavored vapes that appeal to adolescents. This initiative will impose significant penalties on violators to curb the availability of these high-nicotine products. In New York City's Lower East Side, residents are battling the proliferation of unlicensed cannabis shops, which we've talked about in the past few months. But these shops have tripled since 2021. Despite efforts to shut them down, many continue to operate, posing challenges for law enforcement and community safety. The FDA has approved the first menthol-flavored e-cigarettes by Enjoy, a decision that has sparked controversy among public health groups concerned about youth nicotine addiction. While intended to help adult smokers transition to less harmful products, as most other e-cigarette products are really marketed, the approval has faced criticism for potentially appealing to young users. Lastly, Zyn nicotine pouches are experiencing a supply shortage in the US due to soaring demand. These pouches, popular for their discreet use and variety of flavors, have raised concerns about their appeal to underage users. The company plans to open a new production facility in 2025 to address the shortage. Now let's move on to always a favorite, climate and the environment. Extreme heat waves have swept through the eastern U.S., highlighting the need for awareness of how medications can exacerbate heat-related illnesses. Diuretics, ACE inhibitors, beta blockers, certain antidepressants, and antihistamines can all impair your ability to stay hydrated and regulate body temperature. And this is especially true during a heat wave. So if you're in any of these medications, just stay hydrated, stay cool, and make sure you're talking to your healthcare providers. This month, the EPA proposed new regulations on N-methylpyrrolidone, or NMP, a solvent that's used in products like paint remover and cleaning supplies. NMP is linked to health issues like miscarriages and reduced fertility. The new rules aim to ban its use in certain commercial applications and limit its concentration in consumer products, continuing the Biden administration's push to regulate harmful chemicals. This month, the CDC data shows a spike in heat-related illnesses in regions like New England and the Midwest due to the recent heat waves that we just talked about. Emergency room visits went up, highlighting just one of the many trends related to this increase in heat waves that we've been having. Now let's move on to global health. Several London hospitals faced severe disruptions after a cyber attack on Synovi's, leading to over 800 operations and 700 outpatient appointments being rescheduled. The NHS has called for medical student volunteers and blood donations to mitigate this impact. In South Africa, there's been a shortage of insulin pens as pharmaceutical companies focus on producing weight loss drugs. Over 4 million diabetics must switch to less user-friendly vials, raising concerns about treatment adherence. Japan reports a record surge in streptococcal toxic shock syndrome, or STSS cases, a deadly infection. Experts highlight the need for hand hygiene to prevent the spread, especially among the elderly. And remember the rising cases of monkeypox that we were talking about last month? Well, South Africa has received its first batch of tecovirimat to treat rising mpox cases, with 13 confirmed infections. The antiviral aims to manage severe cases, while mild cases receive supportive care. Now let's move on to the more businessy side of healthcare and talk about pharmaceuticals and drugstores. An FDA advisory panel unanimously endorsed the approval of Eli Lilly's new Alzheimer's drug, donanemab. Despite modest benefits and risks of brain swelling and bleeding, the panel concluded that the drug's potential to slow cognitive decline outweighs its dangers. If approved, donanemab will compete with Leqembi, another amyloid-targeting Alzheimer's drug. Conversely, the FDA panel rejected MDMA-assisted therapy for PTSD. Concerns over study designs, potential for abuse, and safety risks influenced the decision. Despite positive outcomes in trials, the panel felt further research was needed to ensure safety and efficacy. The FDA also recommended a new COVID vaccine formula targeting the JN.1 variant for the upcoming fall immunization campaign. This decision aligns with the WHO guidance and aims to improve protection against the evolving virus strains that we talked about earlier. The Serum Institute of India is expanding production, anticipating a doubling of vaccine demand in the next 5 years. New vaccines for malaria and cervical cancer are expected to drive growth, with efforts also underway to develop vaccines for dengue and flu strains. Lastly, CVS faced scrutiny for numerous recalls of its store-brand drugs linked to manufacturing issues at third-party facilities. A Bloomberg investigation revealed these factories had histories of safety violations, raising concerns about the quality of generic drugs sold by major pharmacy chains. Now let's go on to one of my favorites. Let's talk about GLP-1 drugs. Several small studies suggest GLP-1 drugs like Novo Nordisk's Ozempic and Wegovy and Eli Lilly's Zepbound can curb cravings for drugs and alcohol. Despite the potential to address addiction, pharmaceutical companies prioritize these drugs' lucrative market as obesity treatments. Semaglutide, the ingredient in Ozempic and Wegovy that we've talked about in its own episode, has shown promise in reducing alcohol consumption and cravings for other substances. But large-scale studies are still necessary and regulatory approval is still lacking. And it's interesting when we look at where this reluctance actually stems from, right? You got to think about it. It's stemming from the obesity market and the profits anticipated there, which are projected to reach $93 billion by 2030, making it pretty reasonable for these companies to want to focus on the obesity market for now. The WHO issued a warning about fake Ozempic circulating in Europe and the Americas, posing health risks due to incorrect or harmful ingredients. The surge in demand for weight loss drugs has led to a rise in counterfeit products, especially as regulations allow compounded versions in shortage situations. Big food chains like Danone and Nestle are adapting to the Ozempic revolution by marketing nutrient-rich products that appeal to users of GLP-1 drugs. Danone reports increased demand for its high-protein, low-calorie yogurts, while Nestle plans to launch a new line of meals and supplements tailored to those taking slimming injections. Now in the UK, Eli Lilly's Mounjaro, or Zepbound, is being recommended for weight loss in certain patients, potentially offering broader access than Novo Nordisk's Wegovy due to fewer restrictions on its use. This move positions Lilly favorably in the competitive obesity drug market. Michigan's largest health insurer, Blue Cross Blue Shield of Michigan, announced that it would drop coverage for GLP-1 drugs in many plans starting in January, affecting nearly 10,000 people. The decision reflects ongoing debates about the cost effectiveness and safety of these treatments. In Denmark, the health authority advised restricting prescriptions of Wegovy due to its high cost, estimating that it would take around $870,000 to prevent just one severe cardiac event. This contrasts with the broader acceptance in the US, where Wegovy is approved for reducing cardiovascular risks. Now for Medicare, Medicaid, and health insurance news. Uninsured rates among minority groups have fallen dramatically since the Affordable Care Act. From 2010 to 2022, the uninsured rate for Black Americans dropped from 21% to 11%. For Hispanic Americans, it dropped from 33% to 18%. For Asian Americans, from 17% to 6%. And for Native Americans, from 32% to 20%. Enhanced subsidies for marketplace plans introduced during the pandemic played a significant role in helping see these improvements. The Center for Medicare and Medicaid Services is updating its 5-star quality rating system for private Medicare plans following a recent court decision. This adjustment will impact 2025 bonus payments for insurers operating Medicare Advantage plans, providing a much-needed financial boost amidst rising medical costs. New research shows that organized political opposition in the late 1940s, backed by the American Medical Association, derailed support for a national health insurance plan. This campaign increased enrollment in private health plans and diminished public support for national insurance, contributing to the current structure of the U.S. healthcare system. But, should we really be looking to the past to try to put the blame on people, or should we be looking at the future for ways to actually fix the system that we have in place now? The Biden administration is investing $500 million over 5 years to support insurance, quote, navigators, who help Americans enroll in marketplace plans, aiming to sustain recent gains in coverage among minority groups. Now let's dive into the politics of healthcare this month. We talked a bunch about the debate, but there's more here. A review of New York State's handling of the COVID-19 pandemic criticized Cuomo's decision to centralize the response in his office, but did not fault him for the high number of nursing home deaths. Dr. Anthony Fauci's new autobiography, On Call, came out this month, and it's a super interesting read. He talks about his relationship with all 7 presidents that he served under, and he's got interesting sections on his relationship with Trump. This month, President Biden proposed removing medical debt from credit reports for over 15 million Americans, aiming to improve their financial health and access to loans. The policy is still subject to public comment and seeks to prevent healthcare providers from sharing medical debt with loan providers. While this would not erase the debt, it would help Americans achieve better credit scores. In New York this month, activists renewed efforts to pass a bill to allow terminally ill patients to access life-ending medication. Despite support from medical groups, the bill faces opposition from those concerned about the potential abuses and inaccurate prognoses. With limited legislative time left, the proposal's future remains pretty uncertain. And with that, we've come to the end of June 2024 healthcare news. We covered a ton of different topics today, and if any of the news that I mentioned particularly interests you, feel free to shoot me a message on one of our social media platforms, and I would love to chat with you there. We also post daily content on all those social media platforms, so be sure to check those out. And once again, please leave your feedback so that we can work on making the show better. And don't forget to rate the show on your podcast listening platform. It's really important for us to keep pumping out quality content. Also, make sure to check out the newsletter, which is basically the show notes version of the monthly healthcare news podcast that I record. And with that, I'll see you guys for another healthcare news episode next month. For now, stay curious, stay informed, and most importantly, stay healthy. Thank you for tuning in to this episode of the Gustavo Franco podcast. We hope our exploration of the world of healthcare has been insightful and thought-provoking for you. The opinions expressed here are ours and of our guests, and should not be considered professional advice. This podcast is a collaborative learning experience for both the producers and listeners. While we strive to convey accurate and up-to-date information, we acknowledge that our research may have limitations. We encourage all of our listeners to supplement their knowledge by conducting their own research. If you enjoyed this episode and want to stay up to date on our future releases, make sure to subscribe or follow us on your preferred podcast platform and social media. We highly value your feedback, so please don't hesitate to reach out with your thoughts, questions, or suggestions for future topics. Together, we can foster a more educated America and contribute to a more effective healthcare future. Thank you for joining us on this healthcare exploration.